And welcome, everyone. Thank you for joining us this afternoon. We're happy and delighted to have you on the call with us. So for this afternoon, our webinar is focused on the BPSO request for proposal. It's an information session, and we have about an hour together. We will be recording the session, and so we will post it thereafter available on our website for you to view at a later time. So before we begin, we would like to start by acknowledging the land on which we are gathered today. We recognize that our work and the work of our members takes place on traditional Indigenous territories across Ontario. We also wish to acknowledge that the office of the RNAO is located on the traditional and unceded territory of the Huron-Wendat, Haudenosaunee, and the territory of the Mississaugas of the Credit. This territory was the subject of the Dish with One Spoon Wampum Belt Covenant, which is an agreement between the Iroquois Confederacy and the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. We also recognize that the participants of this webinar are located in other traditional lands across Ontario. Today, this land is still the home to many First Nations, Inuit, and Métis people from across Turtle Island, and we are very grateful to have the opportunity to work on this territory. By personally making a land acknowledgement, you are taking a part in the act of reconciliation, honoring the land and Indigenous heritage, which dates back over 10,000 years. We encourage you to learn about the land you reside on and the treaties that are attached to it. Land acknowledgements are an act of reconciliation, and we must all do our part. So welcome, everyone. My name is Julia Finechko, and I'm the Associate Director for the Long-Term Care Best Practices Program here at RNAO. And with me, I have Sue Sweeney, who is the BPSO Program Manager in the Long-Term Care Program, and Ms. Katherine Wallace, who's the Senior Manager, Guideline Implementation and Knowledge Transfer. So in the next hour, we'll provide an overview of RNAO, situating the BPSO program within our association. We'll discuss scale and impact of BPSO, as well as provide an overview of the program. With that, we'll continue on to discuss the eligibility, as well as the application process and timelines for this new cohort. So in order to situate the discussion, I wanted to provide background in terms of what the RNAO is, which is the Registered Nurses Association of Ontario. And so we're a professional association that represents registered nurses, nursing students, and nurse practitioners in the province of Ontario, Canada. We're a strong and credible voice leading the nursing profession to influence and promote healthy public policy and clinical excellence. And health policy program is a core pillar of RNAO. One thing that distinguishes RNAO as a professional association from others is our best practice guideline and the best practice spotlight organization, Knowledge Movement, which are signature programs of RNAO. And so this best practice guideline program is really about a social movement of science. And so in this photo here, you have depicted 3 pillars. And so you have the pillar at the top, which relates to guideline development, followed by guideline implementation and dissemination on the left, and then monitoring and evaluation. And so our program has been funded since 1999 to essentially develop, disseminate, and actively support the uptake and sustainability of evidence-based clinical, healthy work environment, and systems best practice guidelines. And so we have over 52 that are published and available on our website. Along with that, we have several implementation tools that help support the implementation of these guidelines within various organizational contexts. And so the BPSO is a program that sits within the implementation pillar, and its goal is to influence the uptake and sustainability of best practice guidelines across healthcare and academic organizations, and really with the goal to advance practice excellence and optimize persons, organizations, and health system outcomes. So whether you're in long-term care supporting residents or in the hospital supporting patients, essentially the goal is to optimize the care of these individuals. And so how is this experienced? It's experienced through quality metrics such as decrease in falls, for example, but also in collective experiences of team members that are engaged with BPSO. Here we just have a few quotes that demonstrate the impact of the BPSO program. So Genevieve in the top left shares that the BPSO structure has supported her organization to weave in culture and change while addressing health issues relevant to their clients and communities. On the right, in the white quote there, we have a senior leader from long-term care that really highlights the impact that BPSO has supported with both her personal growth as well as her team's collective growth when it comes to sharing knowledge and influences of quality of care. And lastly, in the orange box, we have a quote from Minette, who speaks to the role of BPSO in fostering a culture of continuous learning and improvement in her organization. And so this afternoon, you will hear more about the impact of BPSO from our wonderful panel speakers. Now, this impact of transforming care and team engagement isn't unique and central to Ontario, but really it's felt all across the world. And so we have over 1,500 BPSOs locally and internationally across health and academic centers, really moving forward when it comes to translating evidence into the care of the people we're serving, as well as transforming the teams providing that care and supporting academic institutions. And so when Genevieve had spoken about that structure of BPSO, this slide really speaks to what that structure may look like. And so there are several BPSO deliverables, and organizations that are partnering with RNAO to become a BPSO are really agreeing to these areas. And so my colleague Sue Sweeney will speak in greater detail as to the deliverables and the structure of the BPSO program. But for now, I invite Katherine to introduce our panel speakers.
Thanks, Julia, for that introduction. And thanks, everyone, for your time today or for viewing this recorded presentation. We appreciate your interest in the BPSO program. We're really proud of it ourselves here at RNAO. And we wanted, as part of this presentation, for you to have the opportunity to hear from some experienced BPSO leaders, to understand firsthand their experiences in being a part of this movement. So my pleasure to introduce our two speakers who are going to answer a few questions that I think will highlight their experiences of BPSOs. So Marilyn Kelly is a registered nurse, and she joins us from Peter D. Clark Center. And Leora Krinsky is from Scarborough Health Network. Hello and good afternoon. And thank you both for participating in today's discussion. So we have three questions. So let's start with question number one. And maybe Marilyn, if you'll get us started and tell us what motivated your organization to join BPSO. Oh, and you just need to come off mute. No worries.
Oh my goodness. And I swore I wasn't going to talk a lot, and then I put myself on mute. We are 4 municipal homes, and we've been looking into becoming BPSOs since probably 2019. And then, as we know, COVID hit, and so everything kind of got put back on the back burners. But we as an institution or a facility or a home have always strived for improving our resident care outcomes, improving our resident satisfaction, improving our staff's knowledge, and to become a BPSO was really one of the things that we thought we would be able to get those goals done with.
Thank you. Thanks, Marilyn. Leora, same question. What motivated Scarborough Health Network to join BPSO?
Thank you for having us. I think both Marilyn and I feel so privileged to be here. To basically parrot what Marilyn has said, but what happened with us is that in 2012, 2013, we were working on person and family centered care. And while I was researching it, it was before most people had put anything together. And while researching it, I found the client centered care and BPG with BPSO. And I read this document and I thought, everything is here in one place. And I took that document to our leadership. And that's what our journey began, because we thought, if that's there, we started looking at all the other BPGs. We saw designation and it fulfilled everything for us, and it was all done. And we were going to have mentors. So it was totally overwhelming, but there was a pathway. And that was the most important thing. And we've been we're in our 13th, 14th year now. So we're pretty old hat at it, and we're in sustain mode, and it's wonderful. Sorry, I'm jumping ahead at the other questions. I'll keep quiet now.
No wonder. No worries, Leora. Thank you. It sounds like for both organizations, a good fit in terms of timing and priorities. Second question is, what has been the greatest impact of BPSO at your site? So maybe Leora, do you want to start us with that one? So greatest impact of BPSO?
Harm reduction. When you stop and think about it, everything that we do is for patient experience and for patient safety. And at the beginning, it was a little overwhelming, but now after 12, 13 years, with the sustaining and on continued growth within our programs, we actually now and I'm boasting for Scarborough, is that we have the best ever harm reduction from 24 to 25, and we can relate it to the BPGs. So I'm going to tell you 3. So if anybody here is looking for data, right, for the pressure injury BPG, we're 42% less acquired, hospital acquired. For dementia, delirium, and depression, we have a 57% less hospital acquired delirium. For falls, we've got a 50% less falls requiring causing moderate harm. So we've got data that can actually show that best practice works. And it took a while for the culture change to occur. But once it did, and once it was sustained, that's when the harm reduction followed. And now we've got 17 BPGs. They're all front-led. They're all led by our front caregivers. And those caregivers have created 8 committees. So we're still working on all 17, but we've got 8 committees related to the BPGs as well as our umbrella. So that's been our biggest impact. And that's not even talking about the pride that the healthcare professionals feel.
Amazing. Thank you. So some powerful data and lots of pride and engagement of staff in this initiative. Wonderful. Okay, for you, Marilyn, the greatest impact of BPSO in your long-term care home.
So for us, I still consider us as baby BPSOs because we just got our designation. So we're still a little bit on the high of getting the designation. But what we noticed and what was easy for us to do is resident satisfaction in being part of their care. The residents we've done our resident satisfaction surveys, and it was a significant improvement across all 4 homes in resident engagement with their care. And that, I have to say, it's because of the family and centered care BPG plus the other ones that we put in, but it really affects our residents. They embrace us, because now when we talk about best practice, we know what we're talking about. And so do our residents.
Mm-hmm. Amazing. For both of you, I'm hearing really improved quality care outcomes valued by everyone. Okay, thank you. Wonderful answers. Question 3, and our last question, a tip you would give to organizations as they contemplate being a BPSO. So again, today we have many joining us to listen to this presentation and then thinking about this RFP that we're going to be talking about in the deliverables. So a tip you would give for that organization as they think about pursuing this further. Why don't we start with you, Leora?
With many years' experience, I have learned governance is needed. We need buy-in from the top down, right? And there is some funding. I was very privileged within a year to be made a 0.5 for BPSO. And having that has been incredible in maintaining oversight, because now we've got 17 BPGs. My second thing is, this is not nursing alone. Yes, it's an RNAO, and we have to make sure that everybody's involved, right? It's organization. It's from the board level down to the housekeeper who's working on the floor must understand that we're working for our patients and patient experience. We also have to show how this benefits the individual healthcare provider, because when they see, a lot of people think best practice, it's so much work. Yes, there's work at the beginning, but as the culture changes and it becomes part of regular practice, you see how much it benefits you. And I use call bells as the easy thing. When you have built that relationship with your patient, there aren't as many call bells. So we use the data to show that. Fight for funding, okay? Try not to work off the side of your desk. It's so difficult. Right? Fight for it. It's worth it. And if you've got the data to show when you're doing your gap analysis and you're seeing how you're going to fill those gaps, right? So fight for it. It's for our patients, right? Don't be daunted by this program. There looks like there's a lot at the beginning. right? But you have a lot. I mean, I've got Katherine sitting in front of me. I don't know what I'd do without Katherine. You pick up the phone and you call RNAO, you call your mentor, and they will help you. And the last thing is culture change takes years. Keep the faith, right? That's it.
Thank you, Laura. Leora, it's just some really important messages, and I can hear the pride that you have in being the lead fighting for your patients, as are all the staff at Scarborough Health Network. Okay, how about you, Marilyn? A tip you would give to an organization who's contemplating BPSO? What do you think they should know?
I think they should do it. I think it really does take a buy-in from all levels of your home. But in our homes, it was something we were excited about before we even started the application process. So, and for municipal, so we went to council and they were excited, and then our directors. So we really, while we were in the process of putting in our application, we were building this excitement about it. And I always talk about the gap analysis when you do it. I always thought at the beginning they were like, oh my God, it's going to tell us they're horrible gap analysis. But what I found with the gap analysis was it also showed us what we were doing right. Mm-hmm. And so it just basically what we needed to tweak to make it even better. So, and I think the group, when we did do our gap analysis and we saw, oh, we're already doing this really well, and we just have to, oh my God, can do this. And we just, and my other thing is, don't think you have to do everything at once. You have 3 years, you have wonderful coaches, you have people you can talk to, reach out and ask. Like, you're not doing it by yourself, you're doing it with a village, and the results are phenomenal. And I can't tell you how great it feels to be standing up at that Best Spotlight organization, getting your certificate and standing there in front of all those people. The feeling is, it was worth all those years, those 3 years of all that work. And our coaches were great. The staff bought in because we were seeing things happening. It was wonderful. So absolutely go for it. It's so worth it. And it just makes you so proud of what you're doing for your patients or your residents.
Amazing. Great words of advice. Thank you, Marilyn. Go for it. Go for it. Okay. And so many benefits. So I think we're going to go for it. We're going to have pride. We're going to have data to show the amazing impact. Again, thank you, Leora and Marilyn, for sharing those insights. We better have an understanding then of these deliverables so that we can be successful as well. So for that, I will turn it over to my colleague, Sue Sweeney.
Thank you. The overview of our deliverable categories, we have 5 categories. We have systematic implementation of BPGs, and we heard about that, monitoring, evaluation, and research. And Leora shared with us some great outcomes of things that had occurred, but we both have qualitative and quantitative results. Dissemination, governance, and accountability. So we talked about, Leora talked about this. So when we're talking about governance and accountability, we really want that top leadership involved. We want them to know what's going on, to give that support, both financially and support of being involved in what's happening at your organization. We want co-leads who will assist with implementation, who will lead that work in your organization. And through history and the years that we've been doing this, we found that when you have 2 co-leads, it works a lot better because you can share the responsibility. If one goes off, the other can pick it up. So we really encourage 2 co-leads to assist with the work. We want you to establish a steering committee and implementation teams. So implementation teams that for each BPG, because we find when the work is spread out throughout your organization and you really engage the front line in the team, it really does help with spreading it out, but also sustainability. There are some dedicated financial resources that are needed, and we do suggest that you ensure that your BPSO information is stored in a central location so that everyone has access. So capacity development and knowledge exchange. So we talked, and Leora talked a little bit about champions and their engagement. What we found, and the evidence demonstrates that when you get that frontline buy-in, when you build that capacity, that really does assist with implementation of BPGs and really the sustainability. So RNAO does offer a launch event at our RNAO, but also we have you do a launch event at your organization to really introduce your BPSO journey and program and really engage everybody from residents, families, your board, your staff, to really engage them in the BPSO process. The other thing that we have you do is apply for advanced clinical fellowship. And please, I'm going over the deliverables very high level, but please refer to the RFP that's available online to get further details. If you'd like to move on. So I do want to talk about champions. And so champions are so important in your BPSO journey. We want to build that capacity, and we want champions from interdisciplinary team and interprofessional. So it's really important that you have champions who are informed, who can assist with that change. And really, RNAO champions training is how do you manage change? How do you plan for it? How do you implement it? And how do you sustain it? So we ask for 20% of your caregiving staff. And so that's 8% the first year, 8% the second year, and 4% the last year. And it's really that knowledge transfer. So RNAO has two distinct events during the year. We have the summit or the symposium. And last year we had a 3-day summit. We called it the extravaganza. It was actually an international event that was attended by thousands. And the energy that's at the BPSO symposiums or summits is unbelievable. It's an audience of like-minded individuals who are really trying to implement evidence-based practice for the excellence in care. So that's a great event, which will be occurring in September. We also have the annual Clinical Best Practice Guideline Institute. And as part of your deliverables, we do ask that you attend each year during your pre-designate. And this is really to support knowledge development. It's the champions workshop, but more intense and talking about application of BPGs and how to really engage your team. The other thing that we do have is knowledge exchange monthly calls. So this is an opportunity for you to share with other BPSOs your opportunities, your challenges, lessons learned. We do give mini sessions regarding different aspects of the deliverables, but it's really your opportunity to connect as a community and share everything you're doing. So systematic implementation of BPGs is really the ground of which BPSO was developed. So we have 3 BPGs that we ask you to implement over the 3 years. 2 of them are mandatory. One is people-centered care, and the other is transitions in care. The third BPG, you can choose a clinical BPG of your choice, or you can do the Youth Wellness Champions program, and I will talk about that. But within the BPG implementation, we use 2 frameworks, and that's the social action framework and the knowledge to action framework. And as part of the implementation planning and reporting, we ask that you do a gap analysis before you start implementing and when you've completed implementation, so post-implementation. We also ask you to develop an action plan. So who's going to do what, looking at all the different elements that are entailed in change management. And then we ask for a sustainability plan. So we'd like to see how you're going to sustain the changes. We've all been in organizations where there's the flavor of the month. And really with BPG implementation, champions training, the Leading Change Toolkit. We want to make change that's sustainable, that's worthwhile, and that staff will continue to implement. So as I talked about, the social movement to action framework, that's how do we engage people? How do we get people involved in the change, get their buy-in in what we're doing? And the knowledge to action is what policies, what processes do we need to implement to get those practices to the bedside? So those are the two frameworks that we really base our BPG implementation on. So I did speak about the mental health and substance use BPSO program, which is actually, will be our second cohort. And they have the same deliverables, except for their third BPG, they pick a mental health and substance use related BPG, or they can pick the youth wellness champions. So I will ask Amber to put the link in the chat for further information. If you're interested in the mental health and substance use, Sabrina, my colleague, leads that work, and she'd be more than pleased to answer any specific questions that you have. And once again, Youth Wellness Champions, there's an online toolkit, and this is the second cohort. So you can once again contact Sabrina or go to the QR code that's on this slide to get further information, or go to the RNAO website and look under Youth Wellness Champions. So monitoring evaluation is another one. So it's so important. We know that we need to see the evidence. We need to have the data, both qualitative and quantitative, to demonstrate the impact of all the work we're doing. So RNAO is very invested in this. We have our own repository and indicators with each BPG that you're required to report on. We have hub reports. So this is an online platform where you can talk about what you've done. It's a great repository for qualitative, and where you can store your action plans, your gaps, and all the elements of your BPSO journey. Every 6 months in your pre-designation, we meet with you as a team and really see where you're at, celebrate the successes, help you work with those opportunities that you may be struggling with, or deliverables that you may have questions about. But the main thing is we're here to support you and to have you succeed. We are partners in this journey. The other, we have a site audit, so senior management will come to your site and just see how BPSO is lived in your organization. And you will have opportunity throughout your BPSO journey to for research, for program evaluation. So we're constantly looking at our BPSO fidelity and really ensuring it's got value and that you can meet those expectations. So our last one is dissemination, and this is so important, such a valued part of BPSO. As you heard Leora and Marilyn, they disseminated today some of the great success that they've had with BPSO. So we do require 3 dissemination activities in the 3 years. Also to publish an evidence booster. So taking your data, your quantitative, your qualitative, and really telling a story and sharing it with others in an evidence booster. We also ask you to submit a manuscript for publication so that we can share. So that's the biggest thing with BPSO, is that we're sharing our success. We're helping improve resident patient care throughout Ontario and the world. We also ask you to have a launch at your organization, and I talked a little bit about that. And we ask you to create a web page with the BPSO so you can brag about all the work you're doing. It's easy advertising. And I've often heard that organizations utilize BPSO not only when they're recruiting staff, but also when they're giving tours, when they're talking about their organizations in different forums, really demonstrating that we're an evidence-based organization and we're really developing that culture. And public visibility, so if you want to go to the next one, Julia. So public visibility, you will see, as you can see, I'm wearing my pins, and Julia and Katherine, we really feel that public visibility and that collective identity is really important, and we call it the BPSO footprint. So you walk into an organization that is very visible, their website. A lot of organizations, BPSOs, have collective culture, so they have pins, they have lanyards. You see a few examples. T-shirts, banners. It's really that active participation. So getting those champions involved, really giving them a cause to get involved with, really including them in the projects in your change management. We want motivational engagement. So getting them excited, having parties, just celebrating your successes, as the individuals talked about, the gap. It not only develops opportunities, but it gives you opportunities to celebrate the great things that you're doing. And we're all doing great things, and it's worth a celebration. And once again, that collective culture. So not only are you bonding with organizations in Ontario, but this is, as Julia had spoken to, this is a worldwide initiative. So it's so important that we have a collective identity. So I do want to say that you are not in this journey alone. You will have a coach who is assigned to you, who will work with you and support you throughout the journey. And we have other supports from RNAO. Once again, I talked about the orientation at RNAO that we have. And Julia, if you'd like to move to the next slide. Orientation, we have champion development. So we assist you not only in developing the champions in your organization, but you have the opportunity to train your own champions to give the curriculum. We facilitate the knowledge exchange monthly. We have the symposium. We have the Clinical Institute. We support and engage you with research and with monitoring and evaluation. Dissemination opportunities. Your coach will assist you in finding those opportunities, really finding your best bang for your buck and what impact. I really like when I'm lucky enough to be in the report review meetings, but I really like when a home starts talking about what they're doing and we're like, wow, that's a manuscript. And they're like, really? Like it's amazing the work that's being done. And so we're definitely here to support you. And all these resources are for free. We are a Ministry of Health funded program, so your coach comes free of charge. So I will hand it off to Julia, and thank you.
Okay, so in terms of the BPSO eligibility criteria, so for the next period being cohort N in long-term care and cohort 10 for the implementation science team. So if you can imagine, there were 9 cohorts before 10 and then a few letters of the alphabet before N, definitely, that have had experience and have really contributed to that global movement of evidence, teamwork, and really what was developed as a grassroots movement. And so in terms of the eligibility criteria for this next phase, this is for organizations that are looking to join in April 2027. And so when you look at the calendar months here, it's really a 3-year period by which you would be starting and engaging in the program. And so the eligibility criteria, as Sue has shared, we do have an RFP document that is made available. It outlines all of the eligible criteria. I will say that there's 8 sort of areas to consider and think about from a criteria perspective, but really it all centers on your organizational commitment and capacity. So as Sue has shared, all of this requires a team effort, a teamwork, intentional resources, support and leveraging of leadership, as well as establishment of project teams, and really with that goal and commitment to take best practice guidelines to translate those to the organizational setting, and really with a lens of being an evidence-based practice organization. And so we ask that there's dedicated leads and co-leads for each of those best practice guidelines that you're implementing, as well as there's project teams that are available to support the implementation. So participating in the gap, working on those action plans, and really helping to really look at sustainability over time in the organization. And so from an application process, so there is an online application that's based on the content that's outlined in the RFP. So in there, we would ask questions in relation to who do you anticipate could be a lead and a co-lead in your organization? Who do you think has the knowledge, skill, and interest, and perhaps related experience? They've led other quality improvement projects within your organization. Other questions will relate to, what are the guidelines you're interested in implementing and why have you chosen them? There will be questions in relation to, how do you undertake the gap? How do you envision doing this work and the timelines for completion of that, as well as the dedicated resources that you have in hand? So how would you budget to have a launch, for example, or as Sue has indicated, to have t-shirts, for example, so that there is that collective identity within your organization. And so access to the online submission form will be available after the intent to submit deadline. And then the online RFP submission, again, will be specific to what the deliverables are in the contract, but really looking at your capacity from an organizational perspective. So once you submit that application to RNAO, we do have an internal process whereby we pull together long-term care coaches from the hospital, community, all areas within Ontario, and really look at each of those applications one by one. So we do have a scoring matrix that we utilize. So again, looking at, have they identified who might be the lead? Have they identified the relevance of this best practice guideline in relation to others? Have they considered and thought about, okay, how would you manage competing priorities or if other projects come into play? And also, how do you envision BPSO becoming a part of your day-to-day? So how do you integrate it into your quality improvement, or perhaps align it with accreditation work that you're doing? Generally speaking, when it comes to BPSO, it's about taking evidence, improving outcomes for patients, for residents, enhancing family engagement and collaboration with partners, internal and external to your organization. And so I think naturally many organizational visions, values, missions are to actually have good quality outcomes, to be a center of excellence. And so really, what is the alignment with that BPSO program and the work that you're already doing and your goals that you have established organizationally and strategically? And so each of the applications are reviewed by approximately 4 to 5 individuals within RNAO. Again, as I said, they're scored against a matrix whereby we're able to provide feedback in terms of areas of strength, areas where the application can be strengthened. And then successful applicants are contacted based on those scores. And so oftentimes you'll receive a call from Sue or perhaps Katherine, and they'll say, hey, we received your application. Overall, it was great. Perhaps this is an area to focus on. Perhaps there's an area to further, I would say, beef up or enhance in the application process. But there is an opportunity to hear back early and look at how you can, again, strengthen that application if need be. And so RNAO will inform the applicants in terms of their success in writing and the status of their application. And so this is the evaluation criteria that we apply. And so it covers a variety of areas, and each area is scored differently. So the first area being scope of work, including mandatory guidelines that are selected. So again, why have you chosen that one clinical guideline in relation to the others? What is the relevance of it or the need within an organizational context? The other one is around organizational support. So again, appreciating this is a large initiative. It's not one that one individual can carry in areas where people have tried to be the lone carrier of this initiative in BPSO. We found extensive challenges. And so, we're looking for support from an organizational perspective. So support from your senior leadership team, from your executive directors, your VPs, but also support from residents and families and other areas outside of nursing, because as Sue had shared, this is not just a nursing program. This is not just a nursing initiative, and really looking at that interprofessional team so that everyone's involved and equally aware. Previous experience with RNAO guideline implementation, monitoring, and evaluation. Great if you've historically pulled up one of those 52 plus guidelines and implemented it in your organization. If you have not, that is also okay. What other quality initiatives have you led in your organization? Where else have you seen success? Perhaps you switched an EMAR system. Perhaps you embedded some new infection prevention and control measures. And sort of what process did you go through in order to ensure the success of those programs? Next is your BPSO team's knowledge, skill, and experience. So again, looking at, who have you identified as those leads and co-leads? What's their background? What's their role within the organization or experience? Capacity to deliver on BPSO requirements is sustainability outcomes. So as Sue mentioned, and she's been with the program since the letter A in long-term care, if you can imagine, and I told her she'll have to stay till Z. But if you can imagine, when we talk about champions and getting those numbers of 6%, 4%, the question is, how are you going to do that? And who are you going to identify? And what supports and mechanisms will you put in place? And then, of course, financial contribution. So as Sue has shared, the program is entirely free. It's funded by the government of Ontario. But again, how are you going to think about backfill, for example, if you're releasing staff to attend the launch or the symposium? What about backfill when we're facilitating a champions workshop, which we will come into your organization and facilitate as a coach? But again, looking at, how are you going to ensure you can gather 30 people in a room to learn about each other and learn about BPSO and really enhance their knowledge and skill and understanding? And so again, the biggest areas of focus are kind of at the top end, but all areas are important and something that we look at when we evaluate each of the applications. So the next question you might have is, this is super exciting. I'm totally on board. What are the deadlines? And if you're like me, you're a deadline person, you write everything down, sometimes in multiple places. But the letter of intent is due on September 14th, 2026. And perhaps, Amber, you can throw the link into the chat as well. The online application opens thereafter on the 15th. I will say, if you miss the deadline because life happens, please do reach out. We are an understanding organization. We're one also where there's many balls in the air simultaneously. And so again, just keeping in mind, these are the deadlines that we're proposing and aligning with. The full proposal deadline is on November 23rd. So as I shared, that will be sort of that questionnaire in terms of, this is what is expected of you as an organization. This is what the program offers and is to be experienced, and how are you going to meet those deliverables and those requirements. And then we'll notify you of the results in February 2027, which may feel like a long time away, but it'll be coming very quickly. I anticipate that. And so thank you so much for joining us this afternoon. I hope we were able to answer some of the questions you might have stepped in with. I'm hoping you have more insight and knowledge in terms of the BPSO program, the impact not only at the patient or individual level, but organizationally, looking at leadership, at the systems, at larger structures. If you have any additional questions or follow-up that you'd like, please do reach out to these individuals. Happy to also provide their contact in the chat, but as well, we will post this webinar thereafter on our website for you to access. And so true to, as Sue had shared, we do have our BPSO symposium taking place. It takes place annually, and it's actually upcoming on Thursday, September 24th. This is followed by our BPSO Ontario Health Teams Summit, which takes place the next day. So again, you don't have to be a BPSO to join, to hear, to learn, to really experience the energy, the momentum, and the excitement of the BPSO movement. We do invite you to join virtually. Again, this is sort of information in terms of the date and where the focus will be. So the first day around building capacity and impact, and then focusing on integrating evidence-based care across Ontario. Likewise, we are the RNAO, and so if you're not a member with us, we do encourage you to join. You can join as an RN, as a nurse practitioner, or even a friend of RNAO. We do have that membership level. And so if you join today, the first 3 months are free because the membership year starts in October. So from now until October, you would not be paying for that time period, and encouraging you to become part of that larger voice. Because as I shared in the beginning, we have many offerings at RNAO, and part of our association is we're member driven. So when it comes to policy, influence, impact, it's very much about having your voice present, hearing your experience, and you being part of that collective in terms of advancing the care for individuals in Ontario and internationally as well. So I'll pause here. I'll open it up to any questions that you may have. I'll invite Sue, Katherine as well, and Amber to respond to any questions if it's more applicable perhaps to any one of them. But I'll pause here in this moment in time and open the floor up. Geeta, go ahead.
Hi, I just had a question. The letter of intent.
Yeah.
Can you provide us with a link to the submission of the letter of intent so that we can start that process? Thank you.
Absolutely. We can do that. Thank you. Thanks, Amber. And thanks, Geeta, for the question.
And really, the
Thank you.
letter of intent, it isn't binding, just to let you know. It's really to let us know if there's interest out there, if we can support you. So you can submit the letter of intent. It does give you access to the actual application once it's released. So kind of, we call it the letter of intent, but it's really submission of your intention to apply.
Thank you. As I shared, please do feel free to contact us here at RNAO. Again, Amber, please, if you may provide your email as well as Silali and Verity's address in there, or perhaps into the chat so that individuals can make note of that. Thank you once again for spending your afternoon with us. Oh, can you clarify how organizations will be selected? Oh, is that the question there? Okay, so sorry, there's a question here from Jennifer in the chat. Can you clarify how organizations will be selected for 2027-2030 BPSO cohort? Is there a maximum number of organizations that RNAO designates in each intake, or is it selection based solely on the strength of the applications? So yes, it is based on the strength of the applications. We don't have a maximum cap at which we stop at. So I do encourage you to, Jennifer and others on the call, to submit your letter of interest or intent to complete that application and complete it as thoroughly as possible. As I shared, if we do come across any gaps in the application, we will follow up with you. So there's also that opportunity, and that's okay if your microphone's not working. Thank you for posting the question in the chat. We appreciate that. So maybe we'll conclude now. I do see the chat is quite active in terms of links, so please do have a look there. Thank you once again for meeting with us this afternoon. As we shared, we will post this webinar as well on the website, so you'll have a point of reference for future, as well as that RFP will be made available, and you'll have a chance to look at that document as well. Okay, thank you everyone. Have a great afternoon.